critics are arguing that Victoria is turning into something of a police state. We've seen new restrictions, including much tougher fines for people who flout the rules today, and now no exercise allowed for those who are meant to be self-isolating. Are those measures necessary? Are they backed by the AMA?
Unfortunately, these actions are all completely necessary because the public have just not heeded the message so far that this virus is out there in the community, it's really dangerous, and it's putting the lives of many, many Victorians and those of us around the rest of the country at risk if we're not able to crack down on it, to get the numbers down and to keep the health system in Victoria operating properly. So it's really tough, and we recognise there'll be hardship for many Victorians, but if we get this done right, we can hopefully come out of this in 6 weeks' time and return to some semblance of normality.
There is a real concern about the impact on healthcare workers in Victoria. A group of frontline workers have signed a letter of no confidence in the group of experts who are advising the Chief Medical Officer in Canberra. They want the Health Minister, Greg Hunt, to intervene and recommend N95 respirators, which I understand are surgical face masks that filter particles for anyone treating patients suspected of having coronavirus. Are you backing that call? Are you actively lobbying the Minister on that front? Do you have confidence in that expert panel?
The important thing here is that healthcare workers are safe at work. They have the right to be safe at work, just like any other type of worker in any other industry. So the N95 masks are an important way to prevent COVID-19 transmission, to protect healthcare workers. And we are unsure to what extent this virus is transmitted by aerosol as opposed to by droplets. So it is really important that N95s are available to any healthcare worker who is dealing with a COVID-infected patient. And we are working with the government to make sure that the recommendations are changed to really protect healthcare workers and adopt that precautionary principle where, rather than just doing what we think is probably okay, we need to be sure that every healthcare worker is safe when they go to work to look after a patient who either has COVID
Surely
or
that's
may have
something.
COVID.
Surely that's something, Doctor, that should already be in place. Are you horrified that that isn't a measure that's being taken at this point? And are you confident the Health Minister will be intervening on that front?
I'm confident that the Health Minister has heard the messages that have been coming out from the medical profession, see some changes. It is a moving feast, and I think the recommendations that have been in place have been there during a time where we didn't have much COVID in the community, and the precautions seemed appropriate and were backed by a lot of different players. The situation has completely changed in Victoria with the amount of COVID and the risk to every health worker, and it's good to see that the government are going to act, and if they don't, we'll certainly be calling them to account for that.
So, sorry, just to clarify then, your understanding is that the government will be acting and providing those N95 respirators to all healthcare workers who are dealing with patients suspected of having coronavirus?
We're expecting to see a shift in the position, yes. Haven't had clarified exactly what that's going to be, but certainly hoping to see some movement. Whether it will be enough, we'll have to wait and see. And if it isn't, we will certainly call government to account. But I think there's a clear view now from the medical profession, and the AMA backs this, that we need to change these rules to reflect the changing circumstances and make sure that every single healthcare worker who attends work is actually safe and is not going to contract COVID from one of their patients. We do recognise that some of the healthcare worker infections have come from the community and have come from dealing with other healthcare workers in non-direct clinical settings. But the reality is you've got over 1,000 healthcare workers who've been infected in Victoria already. It is far too many. It decimates the workforce and it's putting lives at risk.
Keen for your view on how our politicians are working during this crisis. Victoria's upper house is sitting today, despite the Chief Health Officer, Brett Sutton, there telling parliamentary authorities in Victoria that it would be prudent to consider delaying the return of Parliament until new safety protocols are in place. We know that the Liberals upper house leader in Victoria has argued that advice was inconclusive and they decided to push on with Parliament today. On a federal level, the opposition leader Anthony Albanese is arguing that federal Parliament should be sitting by the end of the month. What's your view? Should our politicians be exempt from the rules? Do the rules and the scrutiny of the rules deserve our politicians to be at work as usual?
Our politicians have to set an example for the rest of society. So it is very disappointing that the Victorian Upper House is sitting, despite the Chief Health Officer there recommending that they pause. It makes an awful lot of sense to me to delay it, to show that the same rules apply to all Victorians, and to put in appropriate mechanisms before the very important functions of government get back up and running again. And the same applies to the federal parliament. There's nothing special about politicians. They're not immune from COVID. They haven't been vaccinated, and they and their staff can certainly transmit this virus around the country and completely decimate the economies and the populations of our states, who at the moment are living in this little bubble. So there are ways to make it safe. There are quarantine mechanisms that can be put in place, but they need to be really stringent. And it's certainly a terrible look for there to be a different set of rules for politicians to those that apply to the rest of us.
We've seen South Australia decide to reintroduce some more restrictions despite no evidence of community spread in that state. Is that an overreaction, or would you like to see other states follow suit? I mean, your home state of WA, life's pretty much back to normal there.
Yeah, life is pretty much back to normal in WA, but we are effectively in denial. We have eliminated the virus from the community, but we have not eliminated the threat of COVID, and it only takes one slip-up, as we've seen in Victoria, one really tiny slip-up to create carnage. And that will be amplified if we haven't got social distancing in place. So I do support what South Australia are doing, and I think the other states need to look at Victoria and ask the very clear question of themselves: are we doing enough to make sure this could not happen in our state? Or if it did happen, that we can get control quickly and keep the population safe. Now, with almost no social distancing going on, you can't say that a state like Western Australia is in a safe place in the event that the quarantine breaks down.
So just to clarify, it's the AMA's position that you'd like to see restrictions reintroduced in states like WA, where there isn't the community transmission at the moment?
We need to find the balance between the economy and safety and health, but everyone needs to remember that the worst thing for the economy is going to be an outbreak of COVID. So it's not an either or. We need to work with the reality of people's lives and what people will accept. But yes, the AMA is calling for all states to encourage their populations to do the right thing, to put in enough social distancing so that if the quarantine breaks down, if cases do get into the community, that they're able to be traced, that the health department can find people and can ask them to isolate themselves for a couple of weeks, can do the appropriate testing and keep the viral outbreak under control, return back to elimination. Without a level of social distancing now, one outbreak could be completely out of control before any government could be ready to mobilise the resources and track down those cases.
Dr Omar Khorshid, appreciate your time. Thank you for joining us. Congratulations on your presidency. Look forward to speaking to you again throughout your term. Thank you.
Thanks, Ash.